Assalamu alaikum. So in my previous tutorial I have discussed about the esophageal mucosal wave and esophageal ring, that means Sersky ring. Okay, so one thing more I want to tell you that if esophageal mucosal wave is present with three cardinal features, that means glossitis, iron deficiency anemia, and chelosis, that means angular stomatitis. So this esophageal mucosal wave is termed as Patterson-Brown-Kelly syndrome or Plummer-Vinson syndrome. Okay, that means an special esophageal mucosal wave is called Patterson-Brown-Kelly syndrome, which have glossitis, iron deficiency anemia, and chelosis with the esophageal mucosal wave. Okay, that's it. And it's also called the Plummer-Vinson syndrome or Patterson-Brown-Kelly syndrome. Okay, so we will discuss about the another important topics, and these types of patients is usually found in our ward. This is called the Echolasia. Okay, so you have to remember that Echolasia is a aggregation of three cardinal signs. Okay, what are this? These are incomplete lower esophageal sphincter relaxation. That means your we know that if this is esophagus, there are two sphincters. This is upper esophageal sphincters and this is lower esophageal sphincters. So whenever we deglute a bolus or food particles, the food is move downward towards the stomach from the oral cavity, and in that moment the lower esophageal sphincter is relaxed and the food pass through this sphincter into stomach. But if at any reason your lower esophageal sphincter cannot be relaxed, so your food particles cannot move downward into stomach, that means it will be impacted within this location. It will be impacted. Okay, so this esophageal portion will be dilated because the food cannot be moved downward. Okay, so it remains here within this lower end of esophagus. Okay, so increased lower esophageal sphincter tone, this is number one. Another is incomplete lower esophageal sphincter relaxation. Actually this and this are indicate same things. And number three is esophageal aperistalsis. You know that A means absence. If we know that there is a peristaltic movement which move the food particles from the oral cavity to stomach spontaneously. If this peristalsis mechanism is hampered at any reason, then the food particles will remain within the lower end of the esophagus. This is called the echolasia. Okay, so it is aggregation of three cardinal signs or features. So let's see the x-ray of echolasia. This is the lower end of esophagus and this is the upper end of esophagus. So you can see that the lower end of esophagus is tightly contracted. That's why the food is remained here and the esophageal portion is dilated because it contains the barium meal that we have given for doing the test. Okay, and another is Chagas disease. What is Chagas disease? This is an infectious disease. Whenever the Trypanosoma cruzi infect you, then it will cause destruction of mesenteric plexus of esophagus. Mesenteric plexus of esophagus. All of us we know that esophagus there are four layers mainly. This is mucosa and this is the submucosa and this is inner circular layer, this is outer longitudinal layer and this is adventitia. Okay, so here are two plexus. One is Meissner plexus that is located on submucosa layer, and another is mesenteric plexus. You can see here mesenteric plexus, it is located between the inner circular smooth muscle layer and outer longitudinal smooth muscle layer. So if the myenteric plexus is hampered by this microorganism, which is Trypanosoma cruzi, okay, then your esophagus, that means your lower esophageal sphincters cannot be relaxed. That's why the food cannot move downward into the stomach. That means it will cause the same features like as echolasia. Okay, so echolasia like disease may occur in which conditions? One is diabetic autonomic neuropathy. All of us we know that diabetes, it causes the neuropathy. So this, if this neuropathy occurs in autonomic nervous systems, that means sympathetic and parasympathetic nervous systems, and we know that the parasympathetic and sympathetic nervous systems controls the peristalsis of esophagus. So the peristalsis will not occur, and that means the food cannot move downward into stomach. Okay, and malignancy also can cause. Malignancy cause this by mechanical obstruction, because whenever there is a malignancy, this malignant growth will obstruct the esophageal lumen. That's why the food particles cannot move forward, and they cannot able to go to stomach. Okay, so these are the echolasia and Chagas disease. Another is ectopia. We know that ectopia means that the something in an abnormal position. This is called ectopia, something in an abnormal position. Suppose we know that gastric mucosa, it should remain within the stomach, but if this gastric mucosa is present in upper 1/3 of esophagus, then what it will cause? It will release the gastric acid, it will release the HCl. That's why, but our esophagus is not prepared for protecting itself from the gastric acid. That's why this ectopic gastric mucosal cells release HCl, and this HCl will destroy the esophageal lining. Because we know that esophageal lining is a stratified squamous epithelial cells. It is resistance to mechanical stimuli, that means friction or heat, but it is not resistance to chemical stimuli. The HCl is chemical stimuli. That's why the esophagus, the lining epithelium of esophagus, that means stratified squamous epithelial cell layer, will be erased, and there will be esophagitis, inflammation, cell injury. That means it will lead to ultimately inflammations. And in any case of esophagitis and gastritis, you will find some common features. That means dysphagia, dyspepsia. These are the normal features. Okay. And this ectopic gastric mucosa can also present in your small intestine and large intestine. If these are present in small intestine, suppose this is a small intestine, that means a small intestine is your upper part of the bowel or gastrointestinal tract. So this small intestine is also not resistance to chemical stimuli, especially HCl. That's why this HCl also cause erosion of the intestinal wall, and there will be hemorrhage. You can see there will be hemorrhage, and this blood will goes downward, and it will excreted from the body via stool, and this blood color will be altered because it has to pass a long distance from the small intestine duodenum to the sigmoid colon and rectum, and it will be a darkish color. This is we call melena. And if this ectopic gastric mucosa is present in your large colon, that means your descending colon or sigmoid colon, there will be fresh bleeding with your stool. This is called hematochezia. All of us we know that. And if this bleeding will excrete through vomiting, we call it hematemesis. Okay, We call it hematemesis. Okay. Now another topics, important topics is esophageal varices. Okay, esophageal varices, at first we have to know the simple anatomy behind it. All of us, we know that esophagus has three parts: cervical part, thoracic part, and abdominal part. This is the abdominal part. And this abdominal part is drained by left gastric vein. You can see that these veins are drained into here, and this is left gastric vein, and this left gastric vein ultimately drain into portal vein. This is portal vein, and this portal vein is goes to liver. Then it will come out from the liver as inferior vena cava. So if somebody have the liver cirrhosis or chronic liver disease, that means there is an obstruction within the liver. That's why the venous blood comes from the left gastric vein cannot move forward into portal vein. Why? Because there isn't traffic within the liver. The liver cirrhosis, and liver cirrhosis, that means liver is contracted, fibrosis. This fibrosis will obstruct the blood vessels within the liver. That's why the blood cannot move forward, and this venous blood remain pooling within the veins of esophagus. And if extra blood is pooled within veins, if extra blood is pooled within veins, these veins will be dilated, and their wall will be thin, and it will be less strength. That's why at any time it can be ruptured. Okay, so this dilated and tortuous, you can see this dilated and tortuous, it is called esophageal varices. So what is the complication of esophageal varices? Because the veins are very fragile, and at any time they can be breakdown, and it will cause excessive bleeding. It is a medical emergency, and in 90% patient who have portal hypertension, they develop esophageal varices. Okay, 90% patient of portal hypertensions, we find esophageal varices. And the complication is, if esophageal varices is ruptured, there will occur huge hematemesis, and the patient will undergo the hypovolemic shock, hemorrhagic shock. Okay, that's why we have to give the fluid balance. Okay, fluid and electrolyte balance.